Epilepsy is one of the most common neurological diseases and can impact people at any age. We are here at Mental Health, University of Michigan Health, with Dr. Barbara Swartz, an epileptologist. So Dr. Swartz, why don't you explain to us what is epilepsy?
Epilepsy is a condition in which the brain becomes hyperexcitable, and that produces seizures. So anybody that's had more than one seizure has epilepsy.
And when you talk about seizures, are these those big violent episodes, or can they be smaller and maybe harder to detect?
They can be smaller. They can just be a funny feeling, some tingling, a slight jerking in a limb. And in those cases, the people might just ignore it, but then it might lead to a bigger seizure. So they should be getting attention early on.
What are the treatment options for someone who's diagnosed with epilepsy?
Our first mainstay is medication. We have a lot of different ones available, and we like to individualize them to the patient in terms of side effects and type of seizures. If they fail 2 medications, we consider them intractable. Those people will be further evaluated for either a stimulation device, we have several of those, 3 of those available now, or an actual epilepsy surgery.
What are the negative health impacts of epilepsy?
Well, there's a lot. There's a 25% incidence of depression and anxiety. In people with epilepsy, there's lack of ability to get jobs, lack of ability to drive. So there's a lot of social stigmata that go along with it.
And so getting an early diagnosis is critical.
Yes, and absolutely controlling the seizures is critical.